First of all, very warm welcome from medical experts to be part of this session. So it's really nice to see all of you. So today's topic is a bit different. We all know that autism is very frustrating for the parents. And the recoveries are very slow. So how many of you would like to accelerate the recovery process of your autistic kids? You can write me in a chat box or raise your hand systematically. So friends, shall we start? So nobody is there who would like to see or to accelerate the recovery process of your autistic kids? Yeah, I'm now able to see few messages, which are direct messages. Good. So guys, essentially what happens is, we all know that the autism is really frustrating, right? And there are many reasons because of this frustration. One of the first and foremost reason is the recovery rates are very slow. And second, it's very difficult to see our childs lagging behind with other childs, and that too continuously. At times we are able to see our own kids are lagging behind by a few years, and in some cases even decades. And it becomes very difficult when we socially go out, because at times kids goes absolutely out of control, anywhere, everywhere, wherever they want. And more than that, friends, the conventional treatments depends upon the APA, which we called as an applied behavior analysis therapy. And we also give sometimes some pills when for some symptom suppressions or anxieties and things like that. So ABA, though it's a very scientific way to analyze the behavioral patterns and identify those patterns where the delay in development is there, and we design certain therapies based on learning models and attempt to cover those deficiencies by training the kid. If it is, let's say, something social, then we go for an occupational therapies, behavior therapies. If there are some physically, we are able to see some delayedness, we go for physiotherapy or speech therapy based on the deficiency of the kids. So I'm sure most of the participants here are undergoing some kind of a occupational therapies, ABA therapies, or speech therapies, or behavioral therapies. So these therapies definitely help. It would be wrong if I say these therapies doesn't help, because at the end of the day, the more we are going to train our kids on a certain aspects, the probability of recovery increases. But at the same time, it takes sometimes years or sometimes even a decades when we are able to see our kids relatively normal, independent, able to do their own activities on of their own. Unfortunately, in allopathy, there is no pill as such or a drug as such which can correct the root cause, which is some kind of a damage in the brain. So the challenge in front of us is how we can expedite the recovery process, or rather, is there any way to expedite the recovery process? Guys, the answer is big yes. Yes, there is some means and ways. But again, the problem is the awareness of those options. And if there are multiple options, then how to choose them? And this is precisely the objective of this particular session. So let me see the expectations of the audiences, and this is my way to also understand that how much participative we are, how much serious we are for this particular session. What is the kind of a percentage do you guys would like to see? Write in a chat box 10%, 15% in an acceleration, so that you are giving me a target what I should be achieving during this discussion.
Hello, doctor. This is Bala. Hello.
Yeah, please.
My question is, I came into this session because my son has undergone all the therapies, whatever needed. And I want to make sure how this, stem cell therapy will help my kid if we undertake it. Because we spoke to a doctor up in here and he's unsure as well. And what are your thoughts on that?
Sure. I will come to that. Mr. Malak, give me some time. So there are a few people who are joining. Definitely by the end of this session, you will have all the answers with you.
Okay.
Okay. So give me some time and we'll take the questions during the question answer sections. Keep your question answers ready. Let me let me understand your expectations Let me give you certain options, then we'll take the questions also. So I request you to be with us for some time, and I assure you all of your concerns and queries are going to be handled. So let's guys move fast. So today's session is essentially to accelerate the recovery process and to address or identify the different options. I do have a panel here, panel of doctors, and let me introduce my panel today. We are having 3 doctors in 3 different streams. So first of all, I would like to introduce Dr. Khushbu. Dr. Khushbu, can you come on the screen, please?
Hi everybody, Dr. Khushbu here.
So friends, Dr. Khushbu is expert in stem cell therapies. So one of our friends has raised the question about it, and she is the one who is aware of all the protocols, different protocols, support therapies, which typically give what kind of a result, what kind of a grade of diseases, and all such kind of a thing. So she is going to be here discussing most of the things with respect to the stem cell therapy. Our next guest is Dr. Ashita. Dr. Ashita, can you come say hi to our audiences?
Hello everyone, this is Dr. Ashita.
So Dr. Ashita is going to talk about the homeopathic options which are available to treat autism, to expedite the recovery process. We'll understand very in big detail from her what are the options in a homeopathy do we have. Our next guest today is Dr. Nikita. Dr. Nikita, can you unmute and say hi to our audience so that audience can see you?
Hello everyone, I'm Dr. Nikita from India.
So she's Dr. Nikita, and she's going to represent the Ayurvedic sciences and what are the options do we have in Ayurveda. So friends, I understand the audience here are from multiple countries even. So not everybody is aware about what the stem cell therapy is, what the science is, what the homeopathy is, what the Ayurvedic is. So first of all, we will go and try to understand little bit each of these different sciences or streams of healthcare industry. And worldwide, they are not so famous, but in India, most of us know these things or streams. Stem cells comes in on a kind of advanced treatments. Homeopathy and Ayurveda are typically termed in a category of alternative medicines and pretty effective. So let's understand. So first of all, Dr. Khushbu, I would like to ask you something about the stem cell therapy, what the science is, what your basis is, and how do you typically the stem cell therapy works and gives the results. We'll come later about autism also. First, we want to understand the science of stem cell therapy. Dr. Khushbu.
Yeah. So the basic science of stem cell therapy is using the regenerative power of stem cell. Stem cells are the basic building block of the body, and they can form any kind of specialized cells forming any kind of specialized functions. So the basic biological task is repairing and regenerating the damaged cells. This is the exact approach that stem cell therapy uses.
Sure. Thanks, Dr. Khushbu. So let's understand the homeopathy. Dr. Ashita, can you give something, talk about something about the homeopathy? How do you treat? How does this science works?
Absolutely. So first of all, thank you everyone for joining, and thank you Dheeraj sir for having us here. Talking about homeopathy, understanding the science, we need to understand the principle. The principle is similia similibus curantur. That means like can cure like. Now, basically, when we talk about homeopathy, it has 2 balancing factors, our body and our mind, which together, when it forms an equilibrium, can form a state wherein you do not get any kind of disease. But whenever this equilibrium, or you can say this stable mind or body is unstabilized, you can say disease is formed, and wherein the medication part would be needed. So that is how science of homeopathy works in balancing the both mind and body and having a holistic approach about a patient.
Thank you, Dr. Ashita. So let's now understand the Ayurveda. Dr. Nishita.
Yes, sir, of course. So let me give you a brief idea of what Ayurveda is. Ayurveda is basically the use of Indian medicinal plants for the treatment of disease or any medical condition. Okay, so in Ayurveda, what mostly we do is we diagnose the disease or any medical condition based on 3 different elements, or you can say energies. Okay, so now doshas, we say 3 doshas, that is mostly the element part or the energies you can say. So in Vata dosha, we have air and space energy more or the element more, which governs the movement part of the body. Okay. Second comes the Pitta dosha, which has maximum of the fire energy or the fire element, and which handles the metabolism part of the body. And third comes the Kapha dosha that handles the water element, or we can say the water energy, which is mostly governs the emotion part of the body. So that's how we mostly use three doshas or three energies or elements to diagnose the disease or medical condition in the patient. If these three energies or elements are imbalanced in the patient's body, it results into a medical condition or a disease.
Thanks, Dr. Nikita. So let's now, from a general introduction of these sciences, let's have a deep down with respect to today's topic, which is autism. So as far as allopathy is concerned, the hypothesis is the neurons at the time of a birth are the set of neurons with which we have to live throughout the life. If they are damaged, still we need to live with them. So what we do, essentially try to train the rest of the neurons with different therapies. And this complete set is called the ABA therapies, which include physiotherapy, behavioral, occupational therapy, speech therapy, etc., etc. And the science is more focused on to train the rest of the neurons in such a way that we can fulfill the deficiencies by training algorithms, strategies, and mechanisms. My question to Dr. Khushbu, since this is a hypothesis in typical allopathy, how does a stem cell then works in the cases of autism? What is that you are able to do in the cases of autism? Dr. Khushbu.
I'm so sorry. So in case of autism, like I was saying, there is a defect in the brain cells, and this is the science that we are using. From stem cells have the ability to build any tissue in the body. Hence, they have the great potential for brain tissue formation, regeneration, and repair. Along with that, stem cell has two major functions, paracrine and immunomodulatory. Now, I will explain this in very short. Paracrine and immunomodulatory are equivalent to the growth factors that help in communication, learning, behavioral patterns, and also in the immunity of the patient, wherein all of these are affected in a patient with autism spectrum disorder. We are using this power of stem cell to regenerate, repair, and also adapt the immunity of the patient, helping him function independently.
So do you mean that you would be able to regenerate the neurons with these regenerative therapies? And new neurons can also be formed, or what is the scope in your science?
So there is high probability of regeneration of neurons. There is also said that it is neurogenesis is seen. So the damaged part is definitely repaired, and the probability is high of neurogenesis as well. There is no certainty, but probability is very high
for a new neuron generation. However,
yes, absolutely
right. You are definitely emphasizing that the damaged neurons can definitely be repaired, and thereafter you can train them better so that the kids can live a normal life.
Yes.
So which means that you will still require the support of ABA therapy post the treatment. Is that right?
ABA therapies help to elevate the results that have been seen with stem cell therapy. Also, the stem cells that have been infused in the body are trained using these ABA therapies, helping us elevate all the possible improvements that are seen.
Sure. Thanks, Dr. Khushbu. I will come back for more questions to you. But let me also understand in the meantime how Ayurveda sees the autism, and what is the option do we have in Ayurveda to treat the autism or to expedite the recovery process of the autistic kids. Dr. Nikita?
Yes, sir. I will answer that question for you. In Ayurveda, we consider autism has a similar symptoms that of Unmath. Now, in Ayurveda, like I said, we have to diagnose the patient and the disease, or the patient having certain medical condition on based of certain energy that is imbalanced. So now in Ayurveda, we have different types of autism or Unmath. Okay. So in Ayurveda, we have every element wise a different element autism. So if there is a specific single element or energy autism, if the patient is having certain symptoms regarding that specific element, and it is a single autism or single element autism, then yes, it is considered to be one of the mild autism, and we mostly prefer patient by external application of certain herbal medicinal plants for the patient, and also internal medications depending on the age of the patient. The treatment that we suggest to the patient, it depends as per the age of the patient.
Okay. So if it is a single dosha determined as per you, then
Yes.
if there are 2 dosha or a 3 dosha?
Yes, of course. See, if it's a single dosha, it is considered to be a mild autism case, and it is treated by Ayurveda. Even the moderate one is considered to be the combination of two different doshas together. One having the majority of the symptoms, one being in a maximum, I would say, concentration or maximum symptoms of specific imbalanced doshas, or specific element being a maximum imbalance than the other one. So it is considered to be the moderate one. So that can also be treated by Ayurveda. But when it comes to all the three doshas or all the three elements being in imbalance, it is considered to be a very difficult case to be cured by Ayurveda. So we mostly prefer we suggest patient to take help of other allopathy medicine along with Ayurveda, so that we can try to give maximum results to the patient in the third category, that is the severe category that we consider it.
Understood. Thank you, Dr. Nikita. So let's now understand homeopathy. How does homeopathy see the autism as a disease, and what are the options do we have in a homeopathy? Dr.
Yeah,
Ashita?
so see, yes, absolutely. So when we are talking about homeopathic science, we are talking about the imbalance in the equilibrium of mind and body. So the causative factor mainly, as we already know of autism, can either be during delivery, there is any complication due to which autism is caused, or you can say during delivery there was any kind of maybe the cord around the neck or any kind of asphyxia, because of which there was no brain, no proper supply of blood and oxygen to brain. So that is one of the thing. The other aspect is the genetic aspect, and the third aspect we consider here is the pregnancy history of the mother during the whole pregnancy. So basically, whenever there is a trigger point which can lead a patient symptom or autistic symptom in a child, that is what we see in homeopathy. And according to the symptoms, according to the whole character of the child, we give them the medications. But here, what we exactly focus on is, as Dr. Khushbu mentioned in their science of stem cell, they are more focused towards regenerating new cells. Here, we try to train the cells which are present, and we try to maximize their function.
Understood. Thanks for these clarifications. So now I would like to move in another aspect of it. How does each of the sciences take the autism, and how they treat in terms of what their protocols are? Do they give the medications, injections, some therapies, surgeries, some application of external massages and things like that? So let's understand what are the treatment modalities in each of the sciences. So I would like to start with Dr. Khushbu once again with you. What do you do actually in stem cells from the patient perspective? Is it going to be a surgery? It's going to be injection, medication, or something else, some other therapies? What is that typically you do?
So I would like to be very loud and clear that there is no surgery involved. It is a very simple method of using injections that have stem cells with them in them. Now the stem cells can be from different, they can be procured through the patient itself, or can be mesenchymal in origin. We can talk about that later, but in very brief, if I tell you, it is an injection method along with certain supportive therapies to increase the efficacy of the stem cell and the potency of the stem cell, which is hyperbaric oxygen therapy and ozone therapy. Also, sometimes we give physiotherapy and speech therapy so that we can train the stem cells during the period of treatment.
So which means that it's going to be injection-based therapies, right? And
absolutely injection-based.
So you are going to put the stem cells through the injections, right? So,
yes.
What is the typical source of stem cells? Because when we discuss about the stem cells, the source of stem cell is a big ambiguity. And how do our audience understand that? Which source is the better source for the treatment? Which source of stem cell is the better? And what is the, I understand that the stem cells are having multiple properties. They're mesenchymal kind of a thing. They're multipotent stem cells, unipotent stem cells. Can you elaborate a bit on these aspects, the sources and the type of stem cells before we move ahead?
Definitely. So let's go with the sources first. There are major two sources of stem cells. One is our own body blood cells. Our own body fat cells are also a source of stem cells, along with which there are umbilical cord mesenchymal cells. These are the two major sources of stem cells that are being used. Then comes the type of stem cells. Now, the type of stem cells that we are using is usually multipotent stem cells. Why multipotent stem cell? Because these are the ones that do not have any kind of tumor generating marker on them. That is one major reason that, this is a myth that people have in them, that stem cells cause growth of tumor. no, that is not true because we are using the cells that do not have any such kind of marker. So we are using multipotent stem cells, not pluripotent or unipotent stem cells. So I hope I'm answering the question.
Right. Thank you. Thanks. So now let's a little bit understand the homeopathy also. Dr. Ashita, what is your treatment modalities? Do you give injections, pills, medication, or some other therapies in homeopathy?
So absolutely, talking about homeopathic medications, it are the sweet pills, which most of the children like to have. And also there is another form that can be chosen depending on the doctor and depending on the dosage that the child require. It can be given in water. As the homeopathic medicines are the form of alkaloids, they cannot be directly taken. So either the sweet pills or the globules, which are known as the sweet pills, are used as a vehicle to transfer the medicine, or a water can be used as a vehicle source.
Okay. And how comfortable for the kids to consume it? They like it. It's sweet. It's sour. It's because kids definitely are having a trouble taking a medicine. So
definitely kids like homeopathic medicine a lot because it is the sweet medication. It is just as sweet as sugar. And most of the kids which come to us, they always ask for extra, you can say, pack of medicine so that, or extra globules so that they can have it on the other part.
Great. So my summary is it's totally a medication based.
Yeah, it's absolutely a medication based.
Thanks. So now let's understand Ayurveda. Dr. Nikita, what is your modalities of the treatment? What do you typically give? It's again my question: injections, medicines, some therapies.
Okay, so I'll answer that for you. Okay, so in Ayurveda, based on the age of the patient, we have a lot of other types of medication internally that we prefer. Like if I have to suggest a kid who is under 6 year or 7 year, I have to mostly suggest a patient with syrup form, which is in a sweet taste, so that the patient is comfortable taking it. Okay, the other form is in the paste form, the medicinal paste form, so that the patient can have it, and it is also in the sweet taste, so the patient can easily consume it. So it won't be a problem for parents if they want patient to have a Ayurvedic medication internally for their kids. But when it comes to someone who is much older than a certain age and can consume a tablet form, yes, we also suggest them a tablet form also, along with other syrups that are necessary for their symptoms and treatment. Besides that, we also have one more therapy in Ayurveda, that is Panchakarma therapy, which is mostly famous most of the places. To explain it or to so that the audience from other countries would understand, Panchakarma therapy is more like spa therapies mostly, but it also has other therapies included in that, which is not included in spa therapies. But spa therapies has a massage kind of a treatment, which Ayurveda also has a massage treatment, but by medicinal plants depending on the patient's medical condition. So there are other therapies like Panchakarma. We have a nasal drop therapy. Okay, so it also depends on the age of the patient, whether we want to suggest it to the patient or not. Then we also have other therapies where we apply a paste of medicinal plant on the patient's forehead or a proper head, so that the patient gets the benefit of that medicinal plant over certain symptoms that the patient is having. We also suggest a medicinal plant oil that we can use for the patient, mostly where it is called as Shiropichu. Now, Shiropichu is a cotton cloth or a cotton bud, you can say, a cotton ball, you can say, that is dipped in a medicinal oil, and it is kept on the patient's forehead or on the patient's head. As per the treatment plan or as per the treatment suggested for each and every patient, it varies where to place the medicinal oil pichu, or you can say the cotton ball over the patient's head. So besides that, there is one more therapy which we mostly suggest in Panchakarma is enema, that is called as Niroha Basti also. But it is for someone who is much older, and if the patient is comfortable and patient is, I would say, eligible for that part to do that therapy, then yes, we do suggest that part for the digestive part of the complaints of the patient.
Understood. Thanks. So in summary, I understand that Ayurveda is going to be a combination of internal medicines which are to be consumed, yes, and along with certain therapies which has to be applied to the body in the form of oils, massages, or a paste, or something like that. Right? Is the understanding correct?
Yes.
So now let's move to the results. See, we are having this discussion from the perspective of results. All the sciences are good. Allopathy is good. Stemcell is good. Homeopathy is also good. Ayurveda is also good. Our effort here is to discover with the combined panel, what is the kind of results we can get? So results is which is motivating us to assemble here and listen to all of you. So I want to understand what is the kind of results we can expect from each of you. So again, I will follow the same sequence. Let's understand stem cell. What is the kind of results one should expect from a stem cell therapy, Khushbu? Dr. Khushbu?
Yeah. So stem cell therapy gives you results in parts. Initial 15 days, we see some results. Like, for example, the decrease in hyperactivity is seen in the initial 15 days, and major results is seen within 6 months of stem cell therapy. These can include, improved eye contact, improved understanding of the surrounding. Also, it includes, speech. There have been several cases where speech has come to the patient. Obviously, there is required speech therapy because stem cells are being trained. But usually we understand that non-verbal cases are not able to, with conventional therapy, non-verbal cases are not help that much. But with stem cell therapy and these therapies, we've seen patients getting their speech, understanding the speech, and also we've seen more, connect to the surroundings. So hyperactivity decreased, eye contact increased, and speech, the understanding, obedience, instructions, everything comes back within 6 months.
So is it kind of an absolute transformation, or is there some kind of a percentage of results or some kind of improvement in each of the aspect what you have mentioned? Or
so stem cell, no.
It's absolutely normal.
I'll give you a better explanation to this. I think I got you confused. So I was talking on an average. Every patient is different. Every child is different. We give them a lot of, customizations as per the stem cell injections, the number of cells required, the number of therapies, the type of therapies required. There's a lot more just than stem cell.
Understood.
So blood investigations are done. So it's not complete normalcy, but we are trying to get back to normal.
Sorry to interrupt you, Dr. Khushbu. What I was trying to look for, what is the kind of can you, in a layman terms, right? What is the percentage of improvement one can expect? If you're not able to give a generalized figures, you can even give on the basis of, let's say, the mild autistic case, what kind of improvement they can expect. If they are moderate category, then what is the kind of improvement they can expect? If it is a severe category of autistic cases, what is the kind of improvement they can expect in terms of percentage? Because it's important that I understand that it's going to vary case by case, but on average, some figures will help our audiences to understand the impact of a therapy.
Okay, so stem cell therapy in cases of mild and moderate have shown promising results, approximately 50 to 60%. Whereas in terms of improvements, whereas in severe cases, the results are up to 30%, which we've understood in the past experiences.
So these are the improvement, 30% improvement, 50%.
Yes.
So is my understanding right? In case of mild and moderate, stem cell therapy is much more effective than in the cases of severe autistic cases.
Yes, absolutely.
Understood. Thanks for now. I will come back once again to you. So in homeopathy, Dr. Ashita, what is the kind of results we can expect from homeopathy for autistic kids?
So in homeopathy, basically, whatever are the symptoms, any autistic child will have typical symptoms, but there are going to be many specific symptoms attached to every child, which is going to differentiate that child from another. Let me give you an example. Just for example, a child of autism may be screaming, banging the head, as well as there can be children who sit and cry alone. So there are different remedies, or you can say medicines for different kind of, autistic child levels. Now, in homeopathy, basically, it is more of the reactivity that you can treat. So more the reactivity, more are the symptoms that can get settled, or you can say more is the results that we can expect. So it has a little different understanding of even the classifications. As we classify severity, the reactivity is more. In homeopathy, when the reactivity is more, the homeopathic medicine is grasped, or you can say consumed as well as absorbed better, and the results are best. So in cases, I would say moderate and severe cases are best treated where the reactivity of the child is high, wherein the reactivity of child is less or low, I can say, there the results are difficult to generate. And also here I would like to mention that a doctor is very important in homeopathy, because what happens is every doctor is practicing in different types, even in homeopathy. There are symptomatic relief, just like allopathy gives us. Okay. Or also there are causative reliefs which tries to balance around the equilibrium. That is the holistic approach we talked about before. So the doctor, when we choose, if he's approaching towards the holistic approach wherein he's treating the child in disease, then it will have better results rather than just symptomatic relief that can just give you a temporary results.
Understood. So I would like to repeat the question from an audience perspective. If it is a severe category case, what is the in percentage improvement we can expect in a homeopathy? And if it is
With homeopathy, yes. With homeopathy, you can expect 20 to 40% of results, but it is a gradual result that will come, of course, because homeopathy acts on the neurons when they have to get it reactive. So you have to understand somebody who's not able to the cells which are not able to function since child, to get them reactive, it is going to take a little time. So the expectancy of time to get the results varies from child to child. But just to give you a gist about that, it can vary from 2 weeks to even 3 months and also to a year. So continuous, consistent taking of the medication is what can lead to right results.
Understood. Understood. And what about the moderate and the mild cases? As you mentioned, 20 to 40% improvement in a certain time frame. What about the mild and moderate cases? What one should expect broadly?
In moderate and mild cases, if the reactivity is high, we can expect 20 to 40%. But if the reactivity is low, then probably the results will be 10 to 30%.
Understood. Understood. Thanks, Dr. Ashita. Let's now understand what is the kind of a results Ayurveda can generate. So, Dr. Nikita, can you please tell us something more about that?
Yes. Like I previously also mentioned that if we have a single element autism or a single dosha autism, then there are more chances of recovery, or we could say more chances of getting better results in the patient because they are the milder cases. So we can give much results by Ayurveda in mild cases. Then comes the moderate cases where we have the combination of two. So in such cases, we expect somewhere results to be around 40% in the patient, 30-40% in moderate cases. Okay, and in mild cases, you can expect around 50 to 60% results in the patient. Again, it depends from patient to patient. The results may vary as per the patient's body and the medical condition again. But yes, but in severe cases, if you ask, like I also said before, like mostly it is difficult to treat a case where we have all the three doshas or three elements imbalanced. So in such cases, we mostly prefer to take help of allopathy along with Ayurveda. If the parents or if the patient is completely okay with the treatment plan, then we mostly try to go with both the therapies together to give the maximum results in patients.
Understood. Understood. Thanks, Dr. Nikita. So we are able to see what is the level of results each of the science is able to generate. If I need to summarize all three, Stemcell talk about 40 to 50% in a mild and moderate cases, up to the 30% in the cases which are severe, whereas homeopathy is more comfortable with the severe cases where the hyperactivity is more and the things like that, and we can expect 40%. But mild cases, it's going to be 30%. The same from Ayurveda perspective, when it's a single dosh or a double dosh or two element deficiencies, then 40%. And if it is all the three dosha combined, then my understanding goes after listening that it's very difficult to get the results. So perhaps if somebody is of a three dosha kind of a thing, should not be the first line of a treatment Ayurveda for them. So I hope my understanding is right so far.
Yes, sir.
Okay,
Yes,
great.
absolutely.
Now the next question is, we are saying that the results are going to come. When we would be able to see typical the results, because it's important to know the time frame in which the results can be seen. So if you allow me, I would prefer to have the same sequence. So what is when we can see in a Stemcell the first set of a result, when we can say the complete set of results are visible? And I'm adding one more question. What is the sustainability of results? At times, what happens is when we are taking a medicines or some kind of a therapy treatment, there is an improvement in the results, but as soon as we leave that therapy, there is a degradation and it is having a tendency to come back to a normal stage. So there are three questions to each of you. When the first set of results are visible, when the complete set of results we can expect, and what will be the longevity of the results and how long the result will last. Dr. Khushbu, can we hear about Stemcell?
Yes. So, like I mentioned, first set of results are usually seen within 15 days of stem cell therapy, and major visible results are seen in 3 to 6 months after the therapy, where we usually instruct our patients to take support from ABA therapies. The consistency that we've seen on an average is 3 to 5 years, a longevity of the treatment that I would say, and then it is maintained at that place. But in certain, I would say around 5 to 10% cases, we've also seen certain amount of deterioration after 3 to 5 years of stem cell therapy.
Understood. Understood. So then how do you deal with it in certain percentage of your cases? If the results generated by the stem cells are having a tendency to get rolled back, then what's your typical recommendation in such kind of cases?
So what happens is we are here trying to achieve functional independence, which is that the person, I mean the child, is able to do things on of its own. So we ask certain cases or certain patients to take repeat cycles of stem cell, but that is only until the time the person is able to achieve functional independence.
Understood. So there is a possibility in some percentage of our cases whereby, so okay, let me summarize them holistically. 15 days, 2 weeks to 3 weeks, where first set of results will start coming. Complete set of results from a treatment, one should expect from 3 to 6 months. Typically 3 to 5 years, these results are going to remain consistent, whatever is achieved. In certain percentage of our cases, you have observed the rollbacking of our results or a deterioration of results which has been achieved. And in such kind of cases, if required, you recommend the repeat cycles. Is that understanding right, Dr. Khushbu?
Yes, exactly.
Okay. So thanks for that. So let me understand homeopathy also. Again, the same question, Dr. Ashita. 3 questions. When is the first set of results we would be able to see? Then when is the complete set of results we will be able to see? And what is going to be the consistency factor and sustainability factor of the results?
Yeah. So for homeopathy to firstly answer this, first 2 questions are very difficult to answer, but still I'll try to have the best answers so that the audience also understands about it. So firstly, in homeopathy, as soon as the causative factor is hit, only after that the results start coming up. So we need to understand that the identification of the doctor done, whatever the doctor has identified as the causative factor, if it is rightly hit by the medicines, the results can be seen as soon as 2 weeks. But if not hit, it can take as long as even 3 months, 6 months. So that cannot be ascertained how much time a doctor might take to understand the causative factor and get to the roots wherein the treatment can actually be said to be started. And from there, I can say we have seen different people having, as everybody's bodily composition is going to be different. So everybody's reaction to the medications is also going to be different. So in that cases, we have seen patients might getting recovered from 6 months also, but we have also seen patients requiring medications for 3 years. So that is really difficult to ascertain for a patient, that how much for that particular patient will take to, you can say, have the complete results. So that is answering the first 2 questions. Now talking about the consistency of the results. Once the results are achieved with homeopathy, it is maintained constantly. It does not, you can say, deteriorate, or it does not roll back in any sense. Whatever are the results, they will be maintained until and unless the patient is alive. So that is the beauty, I would say, of the science.
Understood. Understood. So my understanding from your explanation is becoming like that. There are going to be a slow process of results generation. And there is going to be a phase whereby there is going to be a discovery phase where you would try to have a hitting the root cause with the certain, I would say, your own protocols and trials you would like to hit. And thereafter, a small improvement will start happening. And based on how long it takes to the normalcy, your treatment will keep on going. Is that understanding right, Dr. Ashita?
Yes, absolutely. It is going to be slowly progressing in terms of even the results.
Thank you. Thank you. Dr. Nikita, we want to understand Ayurveda also now from the perspective of results.
Yes, sir. So see, Ayurveda is basically known for giving results very slowly, but for a longer period of time. It takes a little long to give results in patient, but without any side effect, and it is like sustained for a longer period of time. The results on the patient are sustainable for a very long period of time. But again, when like your second question was, when the patient can see results. So we can consider that the patient may see result minimum after the treatment is started. After the treatment is started, somewhere minimum 4 weeks time may be required in the patient. Again, it will change as per the patient's medical condition, but 4 weeks you can consider minimum is required to see a minimum results in the patient. So when or how long the patient may need the treatment, that is something that you or I can't specifically say without knowing a patient or without knowing someone's medical condition in detail. So there are certain patients, they need treatment for 4 to 5 years. There are some patients who need treatment for 2-3 years. There are some patients who need medication, but not all of them, a specific 1 or 2 medication or certain therapies to be repeated once in 2 years or a year. So it depends on patient to patient. But yes, you can say it is for a minimum 4 weeks to see a minimum visible results in the patient after the treatment is started.
Understood. Thanks for that clarification. So if I need to summarize all the 3 opinions, and please correct me if I'm wrong anywhere, the doctors, I got an understanding that stem cell can give a hype kind of a thing, a quick result within 15 days kind of a thing, and a complete set of results are going to be achieved in 3 to 6 months. Ayurveda and homeopathy are going to slowly and gradually increase the results. The positive part of a homeopathy and Ayurveda is the results are going to be sustainable for a long time. Once achieved, they are achieved for all. There is no possibility of a degradation. Whereas there is a theoretical, there is a quick results in stem cell, but there is a possibility of a bit degradation of a results with time, which can be corrected. That's a different thing. But there is a degradation. Is that the understanding right?
Yes, absolutely.
Great. Thanks. So now let me come to which is the category of a cases, which are, I would say, every doctor or every sciences have some criteria for a patient selections where they can, 1, confidently give the results, 2nd, can give the results on a best effort basis. So I would like to understand your best cases or best selection of a patient where you can give a very confident results. Let me say very confidently generate the results, not on a best effort basis. So we'll follow the same sequence so that it remains easy for audiences to follow the sequence. I will start with stem cell.
So in cases of stem cell, we've seen best results in mild and moderate cases, near severe cases. Not all severe cases has given the best of the results.
Okay.
But I would also like to mention that in severe cases, we have got up to 50% results in hyperactivity and eye contacts.
Okay. Homeopathy perspective, Dr. Ashita?
So in homeopathy, as already explained, it is more of the reactivity and the non-reactive child. So if the child is not much reactive to certain things, that is, we can say mostly which comes into the milder cases, if the reactivity is high, then the probabilities of results are best. But mostly in severe cases, as the reactivity anyways, as the reactions that I'm talking about of any child are more, you can say, highlighted and properly visible, then in that cases, the best possible results are available with homeopathy, I can say.
Understood. Thanks. Dr. Nikita, what about Ayurveda?
Yes, sir. In Ayurveda, it's more like mild and moderate cases, I would say. Severe, yes, but it would be very difficult to get maximum results in the severe cases, and it will take a longer time than the mild and moderate cases.
Sure. So again, I'm just trying to summarize all the 3 sciences. The sweet spot or a best possible results for an stem cells is mild and moderate. There are results in severe one, but that's not of that level. Homeopathy is more comfortable with severe and moderate kind of cases. Absolutely mild, where reactivity is very less, then the results are going to be either delayed or slow, or might not be in some cases there. Ayurveda is also very comfortable with mild and moderate, not so comfortable with, as a best selection, I'm saying, it's not best effort based. Mild and moderate is the sweet spot where the results can be generated with confidence. And a best effort basis, yes, every science can put the best effort and can help you to generate, but this is the summary of the confident results. So, ladies and gentlemen, I would like to share you one milestone what we have achieved so far. As of now, we were discussing there are no means and ways to increase or accelerate the recovery process. We do have, so far, there are 3 options available to you, whereby we can accelerate the recovery process by augmenting either stem cell or homeopathy or Ayurveda, and there is going to be acceleration in the recovery process of the kid. So you may like to choose any one of them. However, I would be prefer to be a bit greedy from a patient's perspective here. Can we accelerate the result a bit more? When you're saying 50% improvement, 40% improvement. So on a recovery pace, I can say the recovery is getting twofold, threefold kind of a thing. By adopting any of the support, provided you fit into a right selection of our cases. But I would like to be a bit more greedy. Do I have a permission to explore how much we can focus more on results?
Sure.
Sure. So let's focus for a while how we can accelerate it further. So one milestone is all the autistic patient, along with the APA therapies, if align the stem cell therapy or homeopathy or Ayurvedic, can expedite the recovery process by 2 times, 3 times kind of a thing. I'm trying to accelerate a bit more here. It's the effort, guys, as of now. So my question to you, Dr. Ashita, if you are getting a patient which is already able to get some set of results from, let's say, stem cell therapy, can you work on that further and improve the results, can take to the different level? For example, if 30% of a benefit is generated by the stem cell therapy, thereafter, can you take that particular case and take it a bit more to generate a bit more higher level of results?
Absolutely. In such cases wherein the stem cell therapy has already generated some results, there would be another set of symptoms which would come up, which can be not only made better, or you can say elevating the results. Along with that, it would be sustaining the results of the stem cell also. So homeopathy can help to sustain the results which somewhere would be lagging from the stem cell side.
Great. So, which means that the risk which exists in a stem cell, a possibility of a deterioration of a result after the treatment, can be taken care by the homeopathy. Is that my understanding?
Absolutely.
Right? And you will
Absolutely.
take it to a next level thereafter. Okay.
Yes.
Really great. So now let me ask with Dr. Nikita also. If you're getting a patient which is already improved at some level, let's say stem cell, we are able to quickly reach to the improvement by 30% in, let's say, 3 to 6 month improvement is there, and you start working on to the patient. So this elevation is going to help you to generate a better result, or it's not, it's going to impact you?
Yes, it will definitely help to give better results in patient. It will not impact in any wrong way. It will definitely benefit the patient more. So if the stem cell has improved a patient to a certain percentage, yes, we can improve it much better in Ayurveda by the help of Ayurveda or certain therapies, and can help to maintain that result that the patient has got from the stem cell therapy to a longer period of time, I may say.
That's really great. So they're looking like a potential, but it's difficult to conclude as of now. Okay, let me ask Dr. Khushbu, would you mind, once you have done the stem cell therapy, if homeopathy or Ayurveda is taking up to generate the next level of results, or helping you to sustain the result to avoid that risk of any deterioration post-therapy?
We'd love to. Who would not want their patients to maintain and stay consistently in the best improved version? All of us in the medical fraternity have a single motto that our patients should improve with whatever diseases they have. So if with the help of any other science, I am able to sustain my results, it's the best.
That's really great. So again, before I still have few doubts in my mind before I conclude for the audiences. There might be some contraindicators in each of your therapies and approaches, and diet and lifestyle could be one. Let me verify that. Is there any contraindicator or contraindication if we try to combine the therapies for a much better acceleration? So, Dr. Khushbu, what is your post-treatment guidelines with respect to the diet and lifestyle?
Okay, so there are no major lifestyle modifications that we actually give to our patients. Major are the diet recommendations, which include gluten-free diet so that it does not trigger the gut. Similarly, there is less use of spice, less use of dairy products, that is lactose, and I think this is the major part: gluten-free diet, less use of lactose, and then yes, sometimes we also give omega supplements or multivitamins if the patient's structure is weak. That's it.
So essentially, gluten-free and lactose-free, right?
Yes.
So in homeopathy, what are the guidelines during the treatment or the post-treatment, Dr. Ashita?
So other than the things that Dr. Khushbu has already mentioned, we do not like the caffeine intake is restricted for the children. You can say there is no camphor intake, or you can say applications to be given, because that is major contraindication for the medicine itself. Because the medicines that come from homeopathy, that can be antidoted because of the camphor, or you can say caffeine. And other than that, the raw onions and raw garlic is something which we don't ask the children to have. Otherwise, what Dr. Khushbu has said, I would agree to that. Even in our homeopathic clinics also, we suggest the same diets.
Understood. Thanks. So let's understand from an Ayurvedic perspective also, what are the typical diet and lifestyle guidelines from Ayurveda during the treatment and the post-treatment?
Yes, like Dr. Khushbu and Dr. Ashita has already mentioned the maximum part. I would only add a few things in the dietary part. That is, the more of spicy food is mostly avoided in the diet, and the preservative added any contained food is completely avoided by the patient. So we mostly suggest the same diet that both the doctors have mentioned before. Other than that, the lifestyle part, we don't have any specific lifestyle plans that the patient should follow, or any specific restrictions the patient should follow. So the dietary part, yes, when it comes to dietary part, we have almost the similar dietary plans that the patient needs to follow with the treatment.
So, okay. So as far as diet is concerned, I'm not able to see any contradiction indications. There is quite enough symmetry. However, Dr. Ashita has mentioned one part, which is camphor. Is in Ayurveda, in any form, be it internal medicine form or in application form, is camphor present in any of the herbs?
In autism, I won't say it is present. Mostly it is not in autism, but yes, in other Ayurvedic treatments that are related to other medical conditions, of course, we have used camphor, but not related to autism. We don't use camphor as such in the treatment.
Wow, great, thanks. So at least diet, lifestyle, I guess all of you have missed. Diet perspective, we are having a go ahead. Is my understanding right from a diet perspective? Please correct me if I'm wrong.
Yes.
Energy. Lifestyle, Dr. Khushbu, any suggestion on a lifestyle perspective?
There's no major modification in lifestyle, to be very honest. We just ask them for supportive therapies. That's it.
Great. Dr. Ashita, homeopathy?
Absolutely. The lifestyle remains the same, although the supportive therapy, as Dr. Khushbu mentions, we also tell them to keep on going with the supportive therapies to train the cells.
Done. Dr. Nikita, Ayurveda lifestyle, any modification is required?
No, not at all. I totally think it is completely fine. Not much of any required, any lifestyle changes is required for the patient.
That's really great. So we do have a possibility of a combination therapy, which can further accelerate the recovery process. So Stemcell, for example, can take we can take a quick jump in the results. Thereafter, for sustenance, we can use homeopathy or Ayurvedic. Now, my question is, what should be the right sequence? Can homeopathy or Ayurvedic medication coexist, can go in parallel?
Well, yes, Dr. Nikita, is it fine if I answer this?
Yes, go ahead, Dr. Ashita.
Yeah. So, according to what my knowledge, homeopathic and Ayurvedic medications cannot go together. The main reason being that you can say the basis of both the sciences are the same. That is, either it is from the plant origin. It is just that Ayurvedic is in more crude form and homeopathic is in more alkaloid form. So that's why when two medications are given together, may it be Ayurvedic and homeopathic together, we don't really know. It has not been experimented what actually the results are being. So it might alter the perspective of that doctor as well as the treatment part. Dr. Nikita, please add into anything if you need.
No, not at all. The only thing I agree with her is that, yes, of course, we can't go together both the treatments because it will again affect the efficacy, and patient won't get that results that the patient will get alone by specific one therapy.
Understood. So, okay, let me modify your question a bit. If we let's say patient choose to go for a homeopathic medicines, can we further accelerate with Ayurvedic application therapies, the medicated oil massages and the panchkarma therapies which you have recommended, is there any issue, Dr. Ashita, if the patient is along with your medication going through some application based, which are not camphor based kind of a things, but rest of the oils, therapies, this I'm not able to recall the name Dr. Nikita gave.
Shiropathy is said to be, and Shiropichu and a lot of treatments.
Shiropichu. So all these external application therapies, Dr.
Yeah,
Ashita,
absolutely. Yes. So absolutely, if they are not involving camphor in any case, then the local applications can be used, although the oral medications cannot be used together.
Great. So if I need to summarize this further acceleration exercise, right? So I'm getting an understanding that in the kind of a cases whereby if the patient first choose to go for an stem cell, thereafter goes on a homeopathy, so the risk or a potential risk, I would say, not in all the cases, but in some cases there exists, so I'm still considering a risk. A possibility of degradation can be blocked by homeopathy, and further positive results can be achieved by homeopathy. And if we further add on the panchkarma therapies, then we can have further acceleration into the results. Is that understanding so far right, or makes sense?
It does make sense, I would say.
Yes, absolutely.
And all of you are pretty comfortable with that, right?
Yes.
Yeah.
So guys, let me show what during in this discussion we are able to achieve. When we started the discussion, we were discovering, is there any way to accelerate the recovery process for our autistic kids? Then we identify the one more level by adopting one of these therapies, and you have understood the difference between all these therapies. You can accelerate the results at a certain level. Then one more level of acceleration we have achieved, whereby if we attempt a combination therapies with the right sequence, with the right set of doctors, the results can be further accelerated, and you perhaps don't need to wait for decades for your kid to become normal. You can seriously expedite that with the combination therapies. So I seriously want to thank you, all the three panel members, which helped us to solve a problem which is a perennial problem as far as the allopathy world is considered and the limitation of ABA therapies are concerned. And one more point which I'm able to really striking me off with respect to sequences. In case of severe cases, there are more restrictions. But I also understood in this description that homeopathy is most comfortable to take the severe cases. So one more possibility I would like to explore, Dr. Khushbu, in case of a severe therapy, if a patient is first going for a homeopathy for, let's say, 6 months and a year and bring down the symptoms level to the moderate level, will that help you and increase your confidence to give the results better?
Autism spectrum disorder, as mentioned, has 3 levels, and the most comfortable situation for stem cell therapy to act is mild and moderate. If we are getting something in plate wherein the patient's symptoms are reduced to moderate, the understanding that we've got through the session is that we will be able to accelerate more and more the results.
So there is a very, very good possibility of creating a combinations and accelerate the results at a different level, right? Individually, what we can do by a right combination, we can multiply the recovery processes further. Is that a fair conclusion I can say as a conclusion of a session here?
Yes,
Absolutely.
Great. So in an ideal case, I understand that we can accelerate one to a certain level, to a next level, to a next level, and can take a recovery journey to a 3, 4, 5 times. We are not talking about a 10%, 20%, 30% of a recovery acceleration. We are talking of number of times here. But there is one more, if I need to take care of my patients, there is one more factor which is very important to take the decisions. Price points. Although we might have discussed the best situations, but I don't know what is the kind of impact it's going to generate on the pockets of my patients. So let's understand that if somebody is having pretty comfortable with the money and is not an issue, then what is the ideal case? I will quickly take your time on that. And if somehow money is a constraint, because end of the day, money plays an important role in a decision making. It has to be there for that. So if money is not sufficient enough, then what is the next best we can do for our patients? So to take the discussion in that direction, first of all, I would like to understand some ballpark numbers. I very well understand that a detailed protocol and a money you would be able to precisely tell once you are able to meet the patient, interact with the patient, understand it better, then only you would be able to give it. But ballpark, so that some kind of answers our audiences can get in this session, I would definitely like to understand the money part also. So, Dr. Khushbu, what is the typical cost of stem cells? Ballpark, I'm not going to make you accountable to hold this. You can have a due diligence. On an average, some ranges, if you can share, that will really help our patients to understand well.
So before giving the cost, let me tell you one major parameter that we look into. That is the number of stem cell injections required. Okay, so on that basis, a lot of things vary, and also the source of stem cell. These are the two parameters that are looked into for the cost. So on an average, it can vary from say 4 lakh Indian rupees to around 10 lakh Indian rupees.
Pretty costly. What about homeopathy? sorry for that comment, Dr.
No problem.
So in homeopathy,
yeah, please.
Yeah. So in homeopathy, if you're talking about the consultation plus the medicine, let's take 1 month of medicine, okay, for just the count. Yeah. The range would be different depending on the doctor and the experience as well as the costing of the medication. But it can range somewhere around 10,000 to it can go even to 50,000 per month.
Okay. And what is the cost ranges for Ayurvedic treatments?
For Ayurvedic treatments, if the medications are only included, you can consider from 5,000 rupees to 20,000 rupees, depending on the medication suggested, but only the internal medication I'm talking about. But if you want to include the therapies, then it could range somewhere from 15,000 to somewhere around 70, 80, depending on the doctor the patient would select.
Okay. So among this, I'm able to understand that stem cell therapy is definitely the costliest one, but is also able to generate quick results, and thereafter the slow results can be maintained. So can I have liberty to make a suggestion? If my dear patients are having, there is no constraint of a money, then the ideal situation would be first go to the stem cells, then go for a homeopathic one to sustain the result and accelerate it further supported by the Panchakarma therapies of an Ayurveda, and you will have a very, very, very different kind of a journey. However, friends, I would also like to mention that in life, what's more important that what is that we can do with our existing resources. If some of you are not having sufficient money, then don't shy away to start with homeopathy or Ayurveda. There may be slow progress, but results will definitely be there. And there also, I would like to say that if the case is of severe category, definitely start with homeopathy. If it is a mild, definitely with the Ayurveda. If it is moderate, I guess you can have a better discussions of a next level, which is a better conditions for you. So if money is not a constraint, then ideal proposition is stem cells followed by Ayurvedic, or you have an option of homeopathy also to take it sustained. Medication part. Application therapies, external applications are only available in Ayurveda. If money is a constraint, go with a homeopathy. Mandatorily, if you are having a severe case, and go with an Ayurveda. And I'm just repeating the ballpark figures and try to translate for international audiences. We are talking about the price point around $8,000 to $10,000-$12,000 for stem cells. For homeopathy and Ayurveda, expected expenditures are boiling down to around homeopathy, I understand $150 to $250 per month kind of a things. And the same by and large is for the homeopathy for external ones. Although if you're choosing a very, very high class facilities and the things like that, then this price can increase. But if I need to consider a minimum range, 8,000 by and large you can consider for an stem cell therapy, $150 by and large you can consider for homeopathy and Ayurvedic per month kind of expenses. So this creates a strategy for you. Whatever the resources you are having, what is the level of acceleration you can achieve? I hope there is no different opinion. If there is different opinion, please highlight so that I can correct here itself.
No, sir.
No.
So perfect. Typically, now the question comes, Next, I'm moving ahead, and we would like to take and prefer. We are now open, guys, for a question. If you are having any questions, please post your questions in your chat box. In the meantime, is there any patient who would like to volunteer to evaluate his or his kid, her kid? What should be the recovery process here? Those who, we would be able to take only one case here, and we will take it live, and we'll try to take the opinions from all the three doctors and try to reach upon some kind of a protocol which is the best for you. Till the point there are nominations coming, I would like to very categorically highlight, my friends, that this discussion is more broad discussions for the disease. Please do understand that the specific case by case evaluation, when it's going to happen, there might be some variations, right? So this is more an average kind of a discussion to build a holistic understanding, but don't take this discussion as a very firm benchmark and start arguing with some other doctor. I heard this kind of a thing there, and why you're not doing this. Please understand that one-to-one evaluation might have certain changes into the broader guidelines because it's good for you, it's good for your kid, it's good for the recovery of the patient. So these are the broad guidelines. The specifics will come out once, only and only when a case is being discussed in very detail and the right protocol can be thereafter achieved. So is there any nominations, my team, can for the case to be taken, or you can raise the questions also? I'm not able to see the messages here. Team, to everyone. I guess there are some technical issues because of which the questions are not. I remember there was one guest who in the beginning itself requested for something, and I also get one message from direct message from Rajiv Sen. Mr. Rajiv, are you there?
Yes. Hello.
Hello.
Yes.
V Sanabot. Can we take a Mr. Rajiv's case in that case, or V Sanabot? We can take one case to discuss in detail so that you can. One case we would like to take right from the what stage and what would be the best protocol for quicker recovery, faster recoveries. Who would like to volunteer?
Me. I want to discuss.
So we'll take the Rajiv Sen case. V Sanabot we will take separately, not online. But we can help you out also. But online, since Mr. Rajiv has volunteered first, so we will respect his. Yeah, Mr. Rajiv.
Actually, I have my niece who is autistic, and I am looking for a treatment. So for that purpose only, I was looking to discuss with the doctors who were discussing just now. So can I discuss with them?
Yeah, please go ahead.
Yeah, so my niece is 7 years old, and she is little bit aggressive, and she does not have a proper eye contact, and she every time does not have proper attention, and sometimes, and she does not speak also. So we are now looking forward what is the best treatment that we can give. So that she is able to get very good improvements, and we are able to send her to a normal school.
Doctors, do you have any specific question, or can I take the bare minimum for you and thereafter you can go for a specific? What's the age, Mr. Rajiv, of the patient?
7 years.
What are the symptoms, behavioral symptoms?
She is aggressive, not proper eye contact, and she does not speak, and attention problem. So we have seen several other autism patients also. So the symptoms are almost same. Like that.
So you have many patients at your hand, or just one?
No, I have seen.
Okay. So is there urinary control is there?
Yes, it is there.
The violence level, is she get violent at certain times?
Yes, she is aggressive.
Okay. And any specific questions, docs, you can also ask if you want to.
Yes, I would like to ask a question from Dr. Rajiv. Mr. Rajiv, how is the sleep pattern of the patient?
She is able to sleep. She sleeps good. So we are already in touch with the neurologist. So she is under some medicines also. So she is able to sleep.
And does she communicate, like speaks, or is she verbal or non-verbal?
She is non-verbal. She does not speak.
Okay, and has she taken some other treatment before or any therapies before?
Yeah, as I told you, she is under a neurologist and she is under some therapies also, speech therapy and occupational therapy, such thing like that.
Okay, and how is her body structure? Is she weak or moderate body structure?
It is moderate. I won't tell weak, but it is moderate.
Okay, and does she has a nauseatic feeling to food or some kind of vomiting symptoms when specifically comes to food?
She does not have any nausea or allergy, but she is very choosy in terms of food. I mean, she is not able to eat every food. I mean, mostly like that. Very selected food she eats.
Okay, and does she has any other deformity besides her autism condition?
No.
Okay. So, Dr. Ashita, if you want to ask any question.
Yes, I would like to ask a few questions. Mr. Rajiv, first I would like to understand a bit more about the pregnancy history. Are you aware about the pregnancy history?
Only it was a C-section delivery.
Okay. First child, second child?
First child.
Okay. And was there any kind of complication during C-section?
There was no complications were there. I mean, my sister is little bit. She was little bit in trauma. I mean, that is how she was little bit in depression, little bit worried. So this type of things were there. Other than that, no as such challenges were there.
Okay. Trauma as in during the pregnancy, she was in some kind of trauma shock?
No, before, not during, before.
Okay, before pregnancy.
Yes.
Okay. After the child's birth, was there any kind of, you can say, disease that prevailed?
No, nothing like that.
Like neonatal asphyxia, jaundice, or any other disease that you know?
No. I have not heard about any such diseases. Otherwise, my sister would have told me.
Okay. And okay, during the pregnancy, was your sister's, like, I would like to understand, I'm not sure whether you must be aware of this or no, but I would like to understand a bit about your sister's mind, or you can say your sister's behavior and reactions during pregnancy. Are you aware about it?
Only I could see whenever I met her. I used to meet her. Whenever I met her, I used to find that she was sometimes little bit worried. I mean, whenever somebody undergoes pregnancy, typically the state of mind that the female has, she also had the same kind. Other than that, I did not find anything additional or anything, alarming.
And as a personality, is she a little anxious person, or she's a more outspoken, more reckless kind of person?
Outspoken. She's a teacher.
Okay, she's a teacher. So, I just one more question, Mr. Rajiv. The child currently, what is his personality type? If you have to describe, is he a worded kind of person, or he is an outspoken kind of person?
No, it's a she. Come again,
Sorry.
please.
Yeah.
Non-verbal. Non-verbal, he mentioned earlier.
Non-verbal, yes.
Yeah, non-verbal. I'm just asking: is the child a worried kind of? That is a very anxious and a nervous kind of child, or she is a outspoken kind of child?
It's very. I haven't observed that thing. I would not be able to tell you. My sister would be able to guide much better on that.
Okay. Not an issue.
Can you suggest whether it's too aggressive or it's more a shy kind of a?
Aggressive.
Okay. Thank you.
Okay. I have a question, if I may.
Please go ahead.
Yeah. So, Mr. Rajiv, just one major question. Is there a history of autism in your family? Is there anybody else who's also been in the spectrum?
No. In our family, we have never had anybody autistic.
Okay. And how about your niece's father's family?
There, okay. Nothing that sort of thing that we are facing now.
Okay. And sorry to ask the next question, but is it a consanguineous marriage within the same gene pool?
No.
Not in the same gene pool. Okay. So also one more question. How about the hemoglobin levels of the child, the structure of the child?
Hemoglobin levels, as of my knowledge, it is good. I mean, it is good because I have never heard
Understood.
something. Yeah.
Okay.
Because if there was something, my sister would have definitely told me. Yes.
Okay. And have you ever had any kind of psychological assessment done for the child?
No, not yet.
Not yet. Any supportive therapies that you're taking and the results that you found in those therapies?
Little bit, we are taking an occupational therapy and also a speech therapy. So we are able to find little bit improvement in her behavior pattern, like aggressiveness is little bit low. I mean, there is some improvements, but then we are looking for the best of, highest improvements that we are looking.
Understood.
So how do you categorize it? Which category the patient is? Mr. Rajiv, can we have some discussion in front of you? The doctors can discuss.
Yes, sir. Yes, sir.
So what's the category you put in this case, docs?
So I think in my understanding, it is a moderate case, but near about moderate severe thin line. This is my understanding.
Doctor?
I absolutely agree with Dr. Khushbu with the understanding. Even I feel it is a moderate case wherein there is borderline to get to severe.
Dr. Nikit?
With both the doctors, mostly it is a moderate case. I won't say a severe one, but yes, definitely a moderate case for us.
So what's the, let's understand if we need to give the best recommendations for a most accelerated recovery, the most accelerated recovery. So what should be, since it's a moderate one, would you prefer a stem cell first? Or what's your recommendation? Please go ahead, share that.
Should I start?
Yeah, please.
Sure.
So what I am understanding in the case is they are already taking the conventional therapies, and for that particular reason, I think stem cell can be forming the base for the treatment along with supportive therapies of occupational therapy, speech therapy. Speech therapy is important because, as they've mentioned very vividly, that the child is non-verbal. So in that case, we need to train the neural cells more. So in particularly stem cells would be required for this particular case that I'm talking of. Stem cells is required with hyperbaric oxygen therapy, with ozone therapy, and certain other occupational therapies. Plus, we can add on to homeopathy or Ayurveda depending on the calmness of the child. But yeah, stem cell therapy is definitely one I would recommend.
Dr.
Hello.
Yeah, can you hear the Dr. Ashita first, Mr. Rajiv? Then
yes,
our recommendation would be complete by then. We'll
yes,
take your. Dr. Ashita,
Yes. So absolutely, as the patient has mentioned that the child is non-verbal. So in that case, I feel my science is little limited in that case, and wherein the stem cells can help him become verbal also. And from wherever the recovery is caused by stem cell, from there homeopathy can take it further and sustain the recovery.
Dr. Nikita?
I would say mostly by Ayurveda. Yes, if the patient is non-verbal, it will take a bit time for patient to recover. But if the patient parents want a quick results or they want results in a less time period, I would suggest them to go for stem cell and then go for Ayurveda. But if they are okay with the time period required to patient to be verbal again, then they can go for Ayurveda as well, I would say. But it will take a much longer time than what the stem cell therapy, I would say. Because what Dr. Khushbu mentioned in the beginning, that the results are visible mostly within like 3 to 4 weeks. Even if I mentioned it within 4 weeks, it's not with the verbal case that the patient would get results within 4 weeks. It would be related to the aggressive behavior or the hyperactivity of the patient. Definitely in 4 weeks, the patient may see few results in that.
So my understanding is building like that. The first recommendation is stem cell. Post that, he's having an option for Ayurvedic as well as homeopathy, right?
Yes.
Yes.
If we want to give him a best of all the three words, okay, let's understand Mr. Rajiv also, what is his preference. Mr. Rajiv, the broad recommendations which are coming is a stem cell followed by homeopathy. And if you're going with a homeopathy, then it can be further augmented by the Panchakarma for a further acceleration, or you can choose to go with Ayurveda as well, because both homeopathy and Ayurveda would be able to take it further. What's your preference from a medication perspective? In Ayurveda, it's going to be more as a syrups, and in a homeopathy, it's going to be more as the homeopathy white sweet balls kind of a thing, medicated one. So is there any preference for that? So you have two options. If you are having any preference in question, we can help you to zero down even there.
Actually, we are also looking for. We heard from some parents. We are also looking for stem cell therapy. We have been looking for that, but I am not sure what is the results or what is the percentage of recovery I can expect. So my question is, even if we go for stem cell therapy and then we go for these two other treatments, that is Ayurvedic and Homeopathy, I have two questions. What is the results that I can expect? And I mean, what would be the gap between the stem cell therapy and these two other treatments?
That's really a very good question. Let's try to get the answer here itself. So what's the kind of a result a stem cell would be able to generate, Dr. Fishbo?
So the case, as for the understanding that I'm getting, I expect a result in this particular case to be around 40%, 30 to 40%. But it is also one more thing I actually forgot. Mr. Rajiv, can you just tell me one more thing? How is the child with the instruction following?
Moderate. I mean, sometimes he listens, sometimes he does not.
Okay, so I just want to correct myself. Since the child is already able to follow certain instructions, we will be able to give around 50 to 55% improvement in the case.
Okay, and
Doctor, you would like to have a range here? Confidently 50%?
No, 40 to 50, 55 is always the range that we give.
Okay, let's keep the 40% as a benchmark. If we are getting more, it's always a good situation for everybody. But for a discussion sake, let's keep the lower limit 40%. From a stem cell, you can expect that. Then if you are going for an Ayurveda, for homeopathy, let's say, then what is the further augmentation homeopathy can bring in this particular case?
So as we see in this case, there is particularly the reactivity of the child is present. That is the responses, the aggressiveness that the uncle mentioned is present. So in that case, you can say percentage would differ from 30 to 50%.
Okay. 40 to.
But of course, it is going to be a slow graph, not like you get the results in 3 months, you will be having 50% result. It will be over a period of time.
And if we add these therapies, Panchkarma also along with the treatment?
Panchkarma treatment along with stem cell therapy, you are asking, Dheeraj sir, or with homeopathy treatment you are asking?
Okay, let me rephrase my question. Stem cell is definitely one of them. Now we have two options. One, if on a medication part, the patient is on homeopathy, then what is the Panchkarma can add? And if the patient is totally with you for medication as well as Panchkarma, then what is that we can expect?
Okay, so if the patient is taking internal medication and external application, both Ayurveda, after the treatment of stem cell therapy, you can expect somewhere results to be with the combination of both stem cell and Ayurveda, somewhere close to 60% maximum results you can expect in a patient. Just by the Ayurvedic treatment, if you're asking me, like I said, it is a moderate case, so somewhere around 40 to 50% chances. If we combine it with the homeopathy internal medication and external application of Ayurveda, you can expect somewhere 10-20% results more with combination of whatever the homeopathy internal medication may give. So if it's like somewhere between a combination of, even we would say 3 therapies together, like if I say homeopathy is going internally and external application, 50-60% we can still expect a result in patient together, like external application of Ayurveda.
Okay. So,
shall I summarize, Mr. Rajiv, for you? Or are you able to get the messages?
Okay, you tell me, and then after that I'll speak.
Sure. So the broad summary is 40% kind of an improvement you can expect from stem cell. Then if you choose homeopathy, you can expect further 30% kind of a 20 to 30% kind of an improvement. And if you are going to add Panchkarma also, then another 10% you can expect. You can expect 60-70% of a recovery in a time frame of the initial phase would be the stem cell, and thereafter homeopathy and Ayurvedic Panchkarma will go on for some duration. You can expect almost for a year at least. So you can expect 70% of a recovery by this. And if you choose stem cell and Ayurvedic medication along with Panchkarma, by and large similar kind of a thing is going to be there, 5% here and there. So you can expect in totality by combination therapies around 70% of a recovery. On a I would say defensive side, I would like you to consider, not the best part. If it is something happening better, you would also be happy. We would also be happy.
Okay. I have one or two questions. Is that all this treatment? I mean, are those treatments are safe? And by combining these treatments, I mean, can we expect our child to go to a normal school, something like that?
Docs, who would like to take it?
Stem cell as per se has no side effects. There have been no noticed side effects for stem cells. And regarding the normal school, I have still not been able to see the exact condition of your niece. So commenting on that would be wrong at this point of time, but we will try our best for the case.
So my suggestion, Mr. Rajiv, would be, this is a broad one. I would recommend a video consultation when the family is involved.
Yes.
There might be certain direct questions with the mother also, father also. If there are some diagnostic reports you are having, the blood reports, which typically gives us some more hint about the internal what's going on, then this question would be more precisely answered. So we need to have to see it can be on a video, the kid, their behavior, aggression, or you can share a recorded video, something more information would be required to zero down beyond this point to particularly give you that level of answer what you're looking for.
Okay. And I will speak to my family. And how can I get the consultation? What is the process?
I'm sure you must be in touch with somebody in a medical experts. Otherwise,
Okay.
I will request my team to publish the medical experts centralized numbers one again. Team, please publish anybody who would like to have a detailed discussion to take it further. So please publish the medical experts centralized WhatsApp number, and somebody will get in touch with you for sure.
Okay. Thank you, sir, and thank you, doctors. And it was really good. Thank you so much.
Guys, we are we are short of a time. We'll take some questions quickly. There are messages which I am able to see. Can you, my team, please highlight that? This is from Diku Binde. Hello, I am a mother of 13-year-old son who has autism. We are considering for stem cell therapy in India. I'm glad to hear other doctors for adding up those combination of treatments. So what's the question? Thanks for the appreciation, Digu, but I'm looking for a question what you are looking to ask for. You have raised the hand. Would you like to come on a mic?
Yes, please.
Okay. Nicholas, you have also, since Mr. Diku or Mrs. Diku is not responding, Mr. Nicholas, you can come and say whatever. Unmute yourself and speak directly.
All right, thank you. I'm speaking from Ghana, West Africa. Okay, so I also have a 3-year-old son who initially, before age 2, was able to communicate with us somehow nicely. I mean, we never detected any challenge with his speeches. But along the line, I think before he turned exactly 2, we realized his speech was going back. He was not communicating with us. He's been aggressive. I mean, very aggressive, hitting objects, and he's not able to follow instructions. And if you communicate back to him, he's not able to understand. So we decided to see doctors, and we were recommended to speech therapists to see them. And so he's been on speech therapy for the past 7 months now. But I think the improvement is just slow, very slow. So we just want to find out if indeed his situation also falls within this category of a patient or ailment, and what best options do we have to getting him treated. Thank you.
Docs, you can please start your question.
So, Nicholas, if you don't mind, you said that before he used to be verbal, and now that he's okay. So the thing is, there is certain delays in the milestones that usually is seen after the age of 2, which is okay. And now that you've had an understanding that he is having certain developmental delays, you can definitely go ahead with stem cell therapy for him. And also, with the understanding that you're giving, this seems to be a very moderate case.
Sorry, your line got truncated along the line, so I didn't hear you from the beginning, please. Sorry.
Okay, I'll repeat, don't worry. So my understanding regarding the case is that it seems to be a moderate borderline case, and stem cell therapy can definitely be done for the case. It is usually seen that children after 2 years of age show major symptoms in cases of autism spectrum disorder because the milestones are seen only after the age of 2. So you can definitely plan to come to India and get the treatment. As you questioned that, do you lie in this category of patients of getting treated with any of the therapies? Yes, it does. And you can definitely plan to, or at least have a consultation first. We will see the child, we will observe. There is a panel out here that will plan, we can plan with the care managers. And then definitely, at this moment, it will be difficult since there are a lot of other patients also, but we can have a one-on-one online consultation. I think there will be somebody in touch with you from the medical experts team, and we can then go ahead with the consultation and then give you a proper conclusion on the treatment plan.
So, Nicholas, my suggestion is going to be, since we are having another 10 minutes, we want to take quick question, but we'll definitely respect you. And my suggestion would be, if you can send more details, you briefly said the summary. If you can attach a video of your kid also, and my team will fix a time, whether we will also like to interact with the mother also. We would like to see on a camera the kid also. Will have more questions. If you are having any diagnostic test done or the earlier recommendation what your doctor has done, then we would be able to do justice. What would be unfair on our part if we are going to, since your question is very important to us, right? We would like to give a right justice to it and want to recommend seriously when we are able to see. So this precisely happen when one-to-one detailed questions come. So the number is already published. You can be in touch, and we can have a separate session. And please budget almost half an hour to 45 minutes for that discussion to go. And thereafter, you can expect a clear milestones and that. At this point of time, if there are any general questions with respect to the discussions we can take, all those who want to have a very detailed discussion with your own personal kids, please get in touch with a detailed discussion, and please budget a time of at least half an hour to 45 minutes for a discussion so that we can do a justice to you. We really don't want to say something on the verbal basis. We would like to see the evidences. We would like to see the reports, the videos, and interactions with the, particularly in a homeopathy, the interaction with both the couples and historical perspective also, the pregnancy, during pregnancy, pre-pregnancy, post-pregnancy developments. It's going to take time. So my suggestion here is, we would like to take the generic questions one-to-one, and we also have one more policy to respect the privacy of our patients. So I really don't want the things like the pregnancy problems should be discussed in public. My recommendation is to have one-to-one video consultation and budget 30 to 45 minutes at least for that, and we would be able to do the good justice. Generic questions, quickly we can take another 4-5 questions right now. It's almost.
Okay, thank you.
Thanks, Mr. Nicholas. Thanks for the answer. So I'm getting a question from Ghulam. How we can determine which type of treatment is good for a patient? So my suggestion is you can schedule one-to-one kind of a detailed consultation, and exactly what is good for you. I can ensure that the people who are as a part of this webinar will have the opportunity, separate opportunity they can get for one-to-one consultations. Typically, we charge for such kind of a services, but for the webinar attendees, since you have spent time with us and heard us very in detail, and since you understand us, it's going to take very less time for you to work upon. This is going to be a free of charge for you, and we can take you can book a slot, budget 30 to 45 minutes for that. Both the couple should be there, the kid should be there, the medical history and the reports would be required, and we can have detailed questions. So there is no one answer. It totally depends upon the case-to-case basis, and I can create an opportunity for you guys to have a detailed sessions on that. So there is a question from Way Samobat. ADHD delay speech. Yes, that's definitely comes under the category of one of the autistic behaviors. So what is the degree of the ADHD which we need to see? I would also recommend you to come with as a couple and a kid, so the team can interact, understand in totality, and can recommend a better solution for you. And there is a high probability that the team might also be recommending that there's no need to go for a stem cell therapy, and therapy Ayurvedic is just sufficient, or a homeopathy is just sufficient. So that I can assure for you. There's a question from Shekhar Biswas. Is there any age limit to apply stem cell therapy? Doc, I would like you to answer. Is there any age limit for stem cell?
The best age is the developmental age, but there is no age limit. For stem cell therapy, the best age of treatment is between 3 to 12 years. That is the developmental age, but there is no age limit to get stem cell therapy. We've seen improvements even after the age of 18 years.
So what's your ideal recommendation? If somebody has to undergo a stem cell therapy, then what is the age when one can expect the best results? One is there is no negative side of it, but
Right.
the age group where the maximum benefits can be achieved.
The maximum benefits are achieved between the age group of 3 to 12.
3 to 12. Understood. And higher it is better or lower it is better?
The lower it is better.
So after 3 years, as soon as possible, but not more than 12 years is what the message is, right?
Partially, yes.
Please correct.
That even after 12 years, there is results seen. That's not that the results are not seen, but the results are restricted.
Understood. So sooner the better post 3 years.
Absolutely.
Is what I would like to say from a results perspective. But if the age of a kid has increased, nothing to worry, and we will be able to definitely do something there also. So there's a second question. Is it possible to arrange a treatment protocol combining both Ayurveda, homeopathy, stem cell therapy, and ozone therapy? Based on this discussion, I can say yes. However, for a better clarity on a sequence and things like that, I would recommend you to have block a session of 30 minutes to 45 minutes, and you will get the guidance. But it's possible, Mr. Shekhar, I can say it here right now. Again, there's a question, Gulam. I also want to know more about stem cell therapy I want to know more about stem cell therapy for recovering process. Can you please let us know more detail about medical experts? Stem cell therapy we talked about quite a lot, and a detailed session we can cover. Yes, if you're not aware about the medical experts, I would like to take this opportunity to talk about the medical experts, though in these sessions we prefer to be more serving side rather than talking about ourselves. But thanks you asked this question. So friends, the medical expert is essentially a global virtual hospital whereby we work with almost 2,000 doctors are in our panel. We are working almost in 18 countries. And our approach is typically have the best of the mind in every streams, not only just in allopathy, but in Ayurvedic, homeopathy, and even in cases like in some cases we work with a Unani. And we do have an expertise with a combination therapies, whereby we are the one who can recommend where the allopathy is good, where the Ayurvedic is good, and where homeopathy is good, Unani is good, stem cell therapy is good. What should be the best sequence where the limitation of one science starts coming and another science can take over. And in allopathy also, we are doing quite a lot of work in international arenas. We typically perform the surgeries in different countries. Few months back, we were in Nigeria and Cameroon, where our team of doctors performed certain surgeries in our orthopedic gynec sections. So that is one of the case. So that's how it's essentially, I would say, a good network of best of the doctors under the banner of medical experts. And we use the facilities when we are outside India with our partner facilities within India with our independent hospitals facilities, and do whatever the best we can do for that. And from a patient-based perspective, 80% of the patients are more international than domestic. So we serve the domestic patients also, Indian patient also. There's no differentiation, but more as a marketing perspective or the current ratio perspective, we serve the international patients more. And since we are doing surgical camps and the things activities outside India, that's perhaps the reason more of that. I hope I answered your question. So the best names of the Indian healthcare you will find attached with medical experts. And this whole team, we are a team of doctors, which with a very different kind of specializations and things like that. My son is, just hold on. This is Dipu Binde. My son is 13-year-old. So are we late for stem cell?
Like I mentioned, you are never late for stem cell. It's just that we will need to work more and there will be more efforts, but we will achieve it.
In case we want to do it at the end of this 2024, yes, you can go ahead for that, but the recommendation would be as soon as possible because it's not late, but the result could have been much better if it would have been earlier. Let me put it like that. Yes, you can go for it by the end of 2024. If you can expedite, it would be good for us, for you, Dipu. And detail, I guess you can have, if you are focused on stem cell, my team will support. If you are looking for a combination, again, you can book a slot for 30 minutes to 45 minutes where we can do a proper justice for your case. Yeah, next question, please. I have to leave due to some official commitments. Can I get a recorded version? I'm from Bangladesh, and let me know how to contact. We would arrange a recorded session to be sent to you. The contact details are already published and is already published in a chat box. You would be having it. That's not an issue. Next question is. So good. We are able to close the generic questions. The specific questions, few of them I'm skipping because I'm hereby offering you an opportunity to interact one-to-one basis, and seriously, don't feel very comfortable when the personal information is coming on a public forum. So please block a slot where you can have a candid discussions with the team. And since you are here in the webinar, you definitely have your medical experts contact. Even if you're not having, it's left on a chat box. And our scheduled time is also achieved. So this is my time to say thanks to our great panel who really helped us from a no solution to the multiple level of acceleration we are able to achieve. From a stagnancy to multiple level of acceleration we are able to achieve with the support of you guys. So on behalf of everybody who has attended, there are a few who has left because of some commitments. On the behalf of everybody, a big thanks to Dr. Ashita, Dr. Nikita, Dr. Khushbu to you to bring a very different kind of a comprehensive solutions and the integration of different schools of sciences to create a better recovery path.
Thank you, Dheeraj sir. Thank you, everyone.
Thank you so much.
Yeah.
So our next big thanks to our audiences who have patiently listened us, and perhaps we took a bit more dive to reach to the nitty-gritties of it. So a big thanks, and more than a thanks, I would also like to mention one more thing, dear friends. See, till the point you are not having a sufficient information, it makes sense that we were living with whatever progress which is happening. Since now you have having a good information, a potentials, how you can accelerate the journey, multiple options you are having today, how you can accelerate the journey. Now it's your time to take actions, my dear friends. It's your time so that your kids can start living a normal life on as soon as possible. The only one thing is going to degrade the quality of life of your kids hereafter is your non-capability to take decisions. He doesn't know anything at this point of time. Unfortunately, challenged by the God. But today you have all the information, right set of information, precise information, scientific information, and the support. Now it's your time to take your call and ensure that the global objective of medical experts is also getting ensured when we are able to generate options for the diseases where the conventional sciences surrenders. You need to act fast. You are responsible to give a good quality of life to your kids. And there are options. If you are having money, you can choose one. If you're not constrained, you can choose two, but definitely do something. These are really a special kids. They really need something different, a good life, and they really deserve it. They can get it. So this is my last message to you. And with that, this is the last message. If since the time is over, anybody would like to have a separate discussion, please communicate with us and we would be more than happy. Since we respect the time of everybody and we are really grateful and thankful to you that you spent 2 hours. We want to respect that. So I would like to, with this thanks and a last note to my patients, I would like to say thank you. Namaskar from India. Good evening, good morning, wherever you are. And serious thanks to be a part of this session. And we wish you all the best that your kids are able to live your normal life on as soon as possible basis. Thank you, dear friends. And please, if I'm not able to take some questions, please excuse me because of a time. I assure you, you get back to us and we will answer all of your questions. You can drop the message from where you get a webinar invite, or WhatsApp number is published in the chat box. Team, please publish once more so that nobody is deprived to get in touch with us. Thank you, dear friends. Thanks a lot. Thanks, doctors, for a part of this session. Thank you.
Thank you, Dheeraj.
Thank you, Dheeraj sir.